It's OPB Politics Now for Friday, October 13th. For a long time now, we've been talking on this podcast about homelessness. You've probably been talking about it with your friends and your neighbors. Politicians have been discussing it in local city council meetings and in Salem. It is the biggest problem facing the state. And it's complicated, intertwined so closely with other big issues like the housing shortage, a lack of mental health care options, and a surging drug crisis. But this week, we're going to take a deep dive and really talk about how we got here, and even better, possible solutions. Welcome to the podcast. I'm OPB Politics reporter Lauren Dake.
And I'm Portland City Hall reporter Alex Zielinski.
Alex, you've written about the state's homeless crisis for a long time. But recently you took a couple of weeks and really dug into how this issue became such a statewide crisis. What did you find?
For starters, while the homelessness crisis may seem like just a few decades old, it's something that really originated over the past century. If I can, I want to walk us through that in a way that's ideally not deeply boring. So at the start of the 20th century, poor Oregonians had a few options available if they couldn't afford to buy or rent a home. They could move into these cheap single-room occupancy hotels, or SROs, which offered rooms for about $12 a night in 2023 dollars. And if they needed more assistance, like they couldn't afford a room and they weren't able to fully take care of themselves, they could move into a state-run poor farm. But by the 50s and 60s, cities like Portland began leveling these cheap hotels to make way for higher-end housing and businesses to spur economic growth, a process often referred to as urban renewal. This came around the same time as the federal government started investing in public housing, building apartments for low-income tenants, which helped fill the void. But by the early 70s, the government pulled a 180 and issued a moratorium on all public housing. And we continue to see a big dismantling of social services, things like welfare, by the federal government in the following years to come. So around the same time, Oregon began shutting down all of its large psychiatric facilities after concerns that it treated patients inhumanely. The state's plan, as you probably know, was to replace these institutions with smaller community-based treatment facilities, but that never happened. Instead, many people with serious mental illnesses were forced into homelessness. Then we saw the war on drugs, we saw more gentrification, really splintering communities and families, the heroin epidemic. The kicker was in the last decade or so when Oregon saw its population surge and housing prices skyrocket. And housing development wasn't catching up at all. Currently, state analysts estimate that Oregon's housing supply is short roughly 140,000 homes to meet the demands of its population size.
I think that you're right that most people do think of this crisis as being something of more of a recent problem. So thank you for walking us through all of that. The experts that you talk to, however, seem to agree that in order to solve what is happening today and right now is really fixing the housing shortage and providing more housing. So how does the addiction crisis and just, poverty and poor mental health that we're seeing unfold on the streets today play into that?
Yeah, so what I learned is that these are all factors that can accelerate homelessness, but they aren't directly the cause of homelessness. For example, cities with really high poverty rates, like Detroit and Philadelphia, have some of the lowest rates of homelessness in the country. And wealthy cities like San Francisco and Seattle have some of the highest. And look at West Virginia. It ranks highest in drug overdose rates while having a very small homeless population per capita. If those were key factors driving homelessness, those parts of the country would have much bigger homeless populations. But there is something that cities with big homeless populations have in common. I spoke with John Tapania, an economist with local firm Eco Northwest, about this, and here's how he explained it to me.
If you simply look across the country and you see where the rates of homelessness are the highest, they're in the parts of the country that have allowed their housing markets to overheat and where they have consistently for years underbuilt relative to population change.
I should quickly note that Tapania is on OPB's board of directors. And what he really underscored was that while having a drug addiction or losing your income may certainly increase the likeliness of homelessness, it really comes down to housing.
So let's talk about some of the people that you talk to who are actually experiencing homelessness. You wrote about some really compelling people who ended up without homes. Can you tell us a little bit about these people who you wrote about?
Yeah, I've always been told that each person has a pretty unique and individual reason for becoming homeless. But I've never seen so many clear examples of that than in my reporting on this story. You know, one woman I spoke with was trying to leave an abusive relationship where her partner controlled all of her finances and she had nowhere else to go, so she became homeless, living in her car. Another woman lost her home in a wildfire and didn't get the federal assistance promised to her and lived in a tent. One man was a caretaker for his elderly mother, and when she passed away, he no longer had a place to live. Here's how one person I interviewed, a Portland woman named Eileen Burns, explained her path into homelessness.
I lost my husband after being married for 20 years. I gave up. I just said, I don't care about nothing. And put all my stuff into storage and hit the streets.
So each person really has their own story. And the only thing in common is that the story begins with really a traumatic or a life-changing event, it seems.
Something I liked about your story was that, well, it was two stories, and one, you really detailed the problem and how we got here, and the other, you offered solutions. So let's talk about those solutions. You talked to people who were able to find more permanent shelter after being unhoused for an extended period. What helped those people find stability?
Yeah, so in the case of the woman I just mentioned, Eileen, she was able to get on a waiting list for this new tax-funded apartment complex in North Portland that runs on this model called permanent supportive housing. And so this is a concept where people experiencing homelessness get placed into their own apartment and are paired with caseworkers, social workers, that help ensure that that person stays housed. So for some people, that looks like someone who can, help connect them to job training, or if someone has a drug addiction, there's on-site treatment. For others, it can be as simple as just having someone to teach them how to make a healthy meal, which can be hard for someone who's, lived without a kitchen or a fridge for years. For Eileen, it was having someone help her get a new ID because her wallet was stolen when she was living outside, and to get her criminal record expunged. She had a charge for skipping bus fare a decade ago. And it also helped her apply to nursing school, which has been a longtime goal of hers. So a lot of things that she wasn't able to do while living outside, and probably would be really hard to do without having someone kind of helping her get there. So it's not just giving someone keys to an apartment and saying, good luck. It's the keys and then the wraparound support to make sure that they can stay on track. Well, there's not a bunch of long-term data on different solutions to homelessness and what are most effective. Permanent supportive housing, this model I just mentioned, has proven to be kind of the most effective of all various programs out there right now.
So permanent supportive housing, offering people more housing, that helps. But it also takes a really long time to build more housing. So what are the short-term options being floated right now to help people get off the streets?
Right. So one option. In the past decade, we've seen private and public organizations create what's been called tiny home villages or tiny pod villages, just clusters of small enclosed sleeping pods with shared kitchen on site and bathrooms, laundry, community space. These have seemed to help as kind of a triage solution to people experiencing homelessness and have really exploded in the past few years. It's a place where folks can take a breath and recalibrate after living outside for years. I visited one in Eugene that's called Opportunity Village and run by a nonprofit. I spoke with a few residents, including one woman named Delaney Clarkson. Here's how she described what the village offered her.
It's a moment to pause. This place has gotten me mentally stable, and that comes from being physically stable, knowing you have a warm place to sleep at night, knowing that your stuff's safe, knowing that my dog's safe, knowing that I have a kitchen to cook in, knowing I have a shower.
And so after people move into this village, residents like Delaney are connected with caseworkers who work with tenants to get them into more long-term housing. And Delaney is now planning on moving into her own place in a few months, which she never really envisioned before.
You mentioned in your story that these type of villages can be really expensive, like up to $64,000 per person every year. And that doesn't include the $500,000 it takes to actually build the villages. So they're costly, but do they work?
Yeah, you're totally right. And like a lot of these new programs meant to address homelessness, there isn't enough reliable data out there to measure this. A lot of these programs are just a few years old. I mean, we get data from publicly run programs like Portland Safe for Us Villages, which is the cost that you mentioned is associated with those programs. And we get data that half of, these villages' tenants have moved into housing, which sounds great, but we have no information on whether those people have remained in housing, whether they've returned to homelessness. We don't really see the big picture yet, and I don't know if we will for a while. I think one challenge in government in general is not yet having the best way to measure what success looks like in addressing homelessness. So that complicates the answer a bit.
There are 18,000 Oregonians who were without shelter in 2022. That is so many people, and presumably that number doesn't even capture everyone. I know one thing I hear about from a lot of people is a frustration of how this seems to be a priority. The city of Portland is getting a lot of money from taxpayers to find solutions. Governor Tina Kotek has carved out a lot of money for this in the state's budget. And yet when you look around, in Portland at least, it doesn't seem to be getting a lot better. Is that accurate? And if that's true, then why is that the case?
Yeah, that's a really important question. I can talk about it on a local level. So in 2020, voters in the Portland metro region passed this big tax measure that put millions of dollars toward funding programs that get people into permanent housing and wraparound services that help them stay housed, like I mentioned before. Those dollars are distributed through the county, which contracts with nonprofits to spend the money. This is a problem because nonprofits that work in this field have a serious staff retention problem. Because of low wages, poor benefits, and frankly, really hard work, we're seeing staff burnt out pretty quickly at these organizations. And so this kind of staff turnover trickles down to impact the ability to resolve the homeless crisis, because a lot of people living outside who might have been close to getting into housing, might have immediately lose touch with these folks. Maybe they lose the promised program, the promised housing, and ultimately remain homeless. That, and they lose trust in the system and may be wary to accept any help again. So that's a big issue. Another more general answer is that we as a state have not invested in housing or helping people before they become homeless for such a long time, that we have just a really large homeless population. And it takes time to know what everyone needs to get them off the streets and reach people where they're at. There's no way to just quickly round everyone up and put them in available housing and call it a success. It's complicated work and it's trust building and it takes time, which I think is the hardest part to really accept, especially when you see the kind of conditions that some folks are living in.
And what options are available out there for people who are so deep into an addiction or a mental health crisis that they may not want help or housing?
Yeah. So just like how there are so many different ways that people become homeless, there are many different ways that they can leave it behind. So for people who are in the grips of addiction, they may not want to move directly into maybe a sober homeless shelter facility. And honestly, that could lead to really dangerous withdrawals. They may instead need, help easing out of their crisis into a supportive housing program or a residential treatment center. So those options are existing. They're not as well funded as they could be, but they're there. I think the question around people in, a mental health crisis where they're not entirely there, they're not able to say yes or no, I want to move into housing, and maybe just don't want to engage, I think that's a little beyond the scope of at least the reporting that I did. It gets into talking about the state's involuntary commitment system, which is a whole other thing, where people can be placed into an emergency room or hospital by an official without their consent if it's proven that their mental health is dangerous to themselves or others. It's definitely a case-by-case situation and far more extreme than the situation for the majority of people living outside.
Was there anything that you learned in this reporting that surprised you?
Well, I don't have to tell you that this is a very divisive topic, and it's hard to find unified agreement on much. But one thing that surprised me was I spoke to, a good amount of quote unquote kind of experts in this field, whether that's sociologists, urban planners, addiction experts, economists. And while they may have disagreed on some nuances about it, they were really in strong agreement that permanent supportive housing, wraparound housing I spoke about earlier, that's the best solution to helping people living outside get housed and stay housed. At the same time, all of those folks I spoke to were also in agreement that for governments to get the kind of money to invest in those programs, they need stronger public support. And they can't really get that support by just building housing and moving people into it over time, since it's not going to have an immediate impact on the number of people camping outside. It just takes time. So all of these people I spoke with agreed that the only way to get the public to support these kind of programs that can solve homelessness is to have the government invest in programs that physically remove visible homelessness from public spaces, like sweeping campsites or moving people into city-sanctioned camps, even if there's honestly absolutely no evidence that this helps address homelessness in the long term. I spoke about this with Marisa Zapata, the director of Portland State University's Homelessness Research and Action Collaborative. Here is how she summed it up.
Everyone wants to use visible, unsheltered homelessness as the marker of success. And so, yes, then the reality is that, well, we can just hide people who are unsheltered and people will think it's successful.
So you can tell she's not thrilled about this idea, but knows that it's what will move the needle. I think I was surprised by how unanimous people were in agreement over this. It really underscores how political this whole issue has become.
It's certainly one of those topics where a lot of people have an opinion. They think they have the solution or they know what needs to be done. I'm curious what the response has been like to your stories.
Yeah, it's been really heartening. I've received a bunch of feedback from folks who expressed gratitude for a story that breaks down the causes and solutions, which is hard to see in kind of piecemeal reporting sometimes. Just this morning, I got an email from a guy who said he'd been working in affordable housing for 20 years and learned a lot from my reporting, which feels nice. I'm surprised, frankly, by how little pushback I've received from people who disagree with the way that I've laid out this crisis. Like you said, there's a lot of opinions. But I have heard from a number of people who live indoors who are frustrated that their opinions about people experiencing homelessness aren't included in my reporting, which isn't to say I don't understand and empathize with those opinions, but I don't believe they always accurately capture the reality of life for people living outdoors.
Overall, what's just been your takeaway after all this reporting? Do you think that Oregon is on the path to recovery? Should people feel optimistic here?
Man, this is such a big issue that I'm really hesitant to express any certainty about which way this will go. You know, I know one thing, that with a historic amount of money coming into the region and the state to address homelessness, we're undoubtedly going to see some kind of growth in housing or services, but that needs to come with really strict oversight, and I'm not sure if we have that in place yet. I don't think anyone is under the illusion right now that homelessness in our state is going to go away anytime soon. For me, whenever I hear a story of one person moving into housing and staying housed, you know, that's hopeful. That helps me stay optimistic. It's really overwhelming to think about the scale of this crisis. And that's why I try to kind of focus on helping, you know, if we see that the system is helping some people regain control over their lives, that feels like progress.
Alex, great job on these stories. Thank you for joining me today. Be sure to check out Alex's stories and all of OPB's reporting at opb.org. This week's episode was produced by Andrew Thien. Our audio engineer is Nalene Silva. Our music comes from Audio Network. We'll be back next week with more political news from across the Pacific Northwest. Thank you for your support, and thank you for listening.